As your physician, I understand how de-stressing age-related hair thinning can be. Our goal with this aloe-based gel is not simply cosmetic, but fundamentally restorative at the follicular level. Age-associated alopecia involves cumulative oxidative stress, low scalp perfusion, and impaired keratinocyte activity. By combining botanical-derived we aim to create an environment in which miniaturized follicles can recover function. Aloe vera serves as the foundational humectant and anti-inflammatory agent. Its polysaccharides soothe keratinocytes and upregulate fibroblast growth factor receptors in the dermopapilla. Studies show that topical aloe penetrates the stratum corneum within 30 minutes, exerting reparative effects on the basal keratinocyte layer. Over successive applications, ideally once weekly. For 3 months, we expect to see reduced telogen effluvium and gradual enhancement of phase duration. Let us now delve deeper into each component's mechanism, dosage rationale, and expected timeline of action. Aloe vera gel composition and mechanism. Fresh aloe, mucilage is rich in anthraquinones and bradykinin enzymes. Repeated application twice weekly can cut protein loss by up to 50% after 8 weeks. These molecules inhibit pro-inflammatory cytokines, like IL-1 beta and TNF-alpha, reducing parafollicular inflammation that accelerates follicle miniaturization. It binds EP3 prostanoid receptors on endothelial cells, causing vasodilation and a measurable increase in scalp blood flow. Delivery and bioavailability. The high water content facilitates transdermal delivery of these clinical milestone. Patients often report reduction in scalp itching and erythema by week 2, indicating barrier restoration. Virgin coconut oil, fatty acid profile. Predominantly, lauric acid and capric acid, both medium-chain triglycerides with low molecular weight, penetrate deep into the cortex. Our single capsule dose approximates that concentration across the gel volume. Protein loss mitigation. By binding to the hair shaft, these fatty acids reduce solubilization of cuticular proteins during washing. Antimicrobial synergy. Lauric acid also exhibits mild antimicrobial properties, helping control microbial scalp overgrowth. Cold-pressed castor oil, ricinoleic acid action. Makes up approximately 90% of the fatty acids in castor oil. Follicle stimulation. Enhanced perfusion, delivers oxygen, amino acids, and micronutrients essential for hair matrix cell proliferation. Chronotherapy tip. Best applied in the evening to coincide with nocturnal peaks in human growth hormone, further amplifying follicular repair. Vitamin E, antioxidant capacity. The phenolic hydroxyl group neutralizes lipid peroxyl radicals, protecting follicular membrane lipids from peroxidation. Clinical benchmark. In studies of androgenetic alopecia, topical, alvetocafferol at 0.1% concentration improved hair count by 34% over placebo at 12 weeks. Tea tree oil, active component, constitutes about 40% of tea tree oil's active fraction. It disrupts microbial cell walls, reducing colonization by Malassezia and Staphylococcus species. Follicular hygiene. By clearing subclinical biofilms and sebum plugs, it prevents follicular occlusion, a common trigger for telogen switch. Safety note, keep under 0.5% VV to avoid sensitization. Patch tesson, the inner forearm, if first use. Lemon juice. pH modulation. Citric acid lowers scalp pH 2 around 5.5, optimizing enzyme activity of acidic mammalian chitinase and promoting desquamation of sebum. Vitamin C delivery. Even small volumes deliver 5 to 6 milligrams of ascorbic acid, supporting collagen synthesis in the extracellular matrix of the dermal clarifying role. Regular mild acid washes have been shown to reduce follicular sebum by 20% and improve drug delivery in topical formulations. Raw, honey, humectant, and osmolite. At 17% sugar content by weight, honey draws transcutaneous moisture into the scalp, improving hydration of follicular. Antibacterial spectrum. Contains hydrogen peroxide and defensin 1 peptides, which help control pathogenic bacteria without disturbing texture and spreadability. Acts as a natural emulsifier, smoothing the gel and aiding even distribution. Rosemary essential oil. Phenolic antioxidants contains rosmarinic and caffeic acids that inhibit 5-alpha, reducing conversion of testosterone to DHT, a key driver of androgenetic alopecia. Follicular proliferation. In vitro studies demonstrate a 20% increase in papilla cell count after 72 hours of exposure to 0.1% rosemary oil. Sensory profile provides a mild, grounding aroma that may improve patient compliance. To ensure the therapeutic efficacy and safety of your homemade gel, we must follow rigorous formulation steps and quality control measures, much like in a compounding pharmacy. Raw material selection and preparation: aloe vera, unblemished leaves from a mature plant to maximize polysaccharide content. After harvesting, trim the edges with a sterilized scalpel and wash under potable water. Pat dry with a lint-free cloth in a clean area. Oils and extracts. Use food-grade, organic virgin coconut oil and cold-pressed castor oil stored in dark glass bottles to prevent oxidative rancidity. Check expiration dates and perform an olfactory inspection. A photo indicates. Verify supplier certificates of analysis for terpenenferol and rosmarinic acid content. Essential oils and actives. Purchase pharmaceutical or therapeutic grade, tea tree and rosemary oils. Aseptic technique and workspace sanitation. Clean all work surfaces with 70% isopropyl alcohol and allow to air dry. Sterilize mixing utensils by boiling in water for 10 minutes or wiping with alcohol. Wear disposable gloves and, if available, a surgical mask to minimize contamination from skin flora and respiratory droplets. Sequential blending protocol. Step A. In a chilled glass bowl, combine 2 tablespoons of fresh aloe gel with 1 tablespoon of melted virgin coconut oil. Maintain the bowl on an ice bath to prevent overheating, which can denature aloe enzymes. Stir gently for 15 seconds. If above 6.0, add lemon juice, dropwise. If below 5.0, add distilled water in 5 milliliters increments. Step B. Using a low-speed whisk, emulsify for 30 seconds until the mixture appears slightly opaque. This pre-emulsion stabilizes oil droplets. After each addition, stir for 20 seconds to ensure Step C. Gradually add 1 teaspoon of castor oil in thin streams, whisking continuously to maintain a uniform oil and water emulsion. Step D. Introduce 1 capsule of vitamin E oil by piercing the capsule with a sterile needle and squeezing directly into the emulsion. Step E. Drop in 3 drops of tea tree oil, 2 teaspoons of freshly squeezed lemon juice, and 2 teaspoons of raw honey. Step F. Add 5 drops of rosemary essential oil and blend for an additional 15 seconds. Discard if color deepens or odor becomes sour. Step G. Adjust pH. Using pH strips, confirm the mixture reads 5.5 to 6.0. Step H. Slowly pour in approximately 100 milliliters of distilled water while whisking to yield a light gel. Continuously monitor viscosity. The final product should hold soft peaks on the whisk and demonstrate pseudoplastic flow. Quality control tests. Appearance and texture. Visually inspect for smooth, lump-free consistency and a pale green hue. Advise the patient to store away from direct sunlight and heat. pH measurement. Confirm pH remains within the 5.5 to 6.0 range to match the scalp's natural acid mantle. Below is the recommended regimen, patient instructions, and follow-up plan. Viscosity check. Use a simple flow, test tilt, a sanitized glass plate, and observe the gel's flow rate. It should take approximately 5 seconds to travel, 5 centimeters. Preservative efficacy. While honey and lemon impart mild antimicrobial action, store the jar in refrigeration at 4 degrees Celsius and plan to use within 14 days. This optimizes transdermal diffusion. Sensory evaluation. Smell the gel. It should have a subtle herbal aroma without rancid or sour off. Labeling and storage. Apply gentle circular motions for 3 minutes per section to promote vasodilation and emulsifier uptake. Label clearly mark with aloe hair restorative gel. Preparation date and use by date. Container. Transfer into a sterilized amber glass jar with an airtight lid to minimize light-induced degradation. Storage conditions. Refrigerated 2-8 degrees Celsius. Occlusion increases transdermal uptake by approximately 20%. By adhering to these compounding protocols and QC steps, you ensure that each batch delivers consistent concentration, safety, and efficacy mirroring standards found in clinical dermatology formulations. As your treating physician, it is critical we follow a structured application routine and track clinical outcomes to ensure safety and efficacy. Avoid harsh surfactants to preserve the deposited lipids and barrier integrity. Air dry. Avoid heat styling for at least 24 hours post-application, routine, pre-application, preparation, perform a scalp, self-test. On day 1, apply a pea-sized amount of gel behind your ear. Wait 24 hours to confirm absence of irritation. Hair dampening. Lightly mist hair with lukewarm water. Hair should be damp, but not dripping. Gel application dosage. Dispense 1 to 2 teaspoons of gel per session. Scalp massage. Use gloved fingertips to apply gel in 1 centimeter wide sections, working systematically from hairline to hair strand care. After scalp coverage, distribute the remaining gel through hair lengths to function as a conditioning agent. Dwell time and occlusion minimum. Leave on for at least 30 minutes to allow active ingredients to penetrate the optimal For enhanced absorption, cover hair with a breathable shower cap and leave the gel overnight. Rinse procedure, water temperature, rinse with lukewarm water to avoid cuticle lifting. Cleansing, if necessary, use a gentle, sulfate-free shampoo. Drying, pat hair dry with a microfiber towel. Do not rub, as this can cause mechanical damage to fragile strands. Frequency, initial phase, once weekly for the first 12 weeks. Maintenance phase, based on clinical response, can be tapered to once every 2 weeks after month 3, contingent on improved monitoring and outcomes. Baseline assessment. Phototrichogram. Obtain high-resolution photographs of a 1 square centimeter scalp area. Count anagon versus telegon hairs to establish baseline. Dermatology. Life Quality Index. Administer to quantify the psychological impact. Follow-up schedule. Week 4. Telephone check-in, ESS, tolerability, any signs of irritation, and patient adherence. Week 8. In-office visit, repeat phototrichogram in same marked area and DLQI survey. Expect 10 to 15% reduction in shedding hairs. Week 12. Comprehensive evaluation measure. Hair density change. Report patient perceived improvements in thickness and shine. Aim for is greater than or equal to 20% increase in anagen ratio. Adverse event monitoring. Mild. Transient. Erythema or tingling from essential oils. Typically resolves within 1 hour. Moderate pruritus or papular rash suggests sensitization. Reduce tea tree or rosemary oil concentration by half. Severe urticaria or persistent dermatitis. Discontinue gel. Switch to isolate aloe-only formulation and consider dermatology referral. Long-term maintenance. After achieving a stable regrowth plateau at 6 months, continue monthly applications or integrate into broader scalp care routine. Counsel on complementary measures, balanced protein intake, iron and vitamin D status, and minimizing mechanical trauma. By adhering to this protocol, we ensure rigorous patient safety, objective monitoring of hair regrowth, and timely adjustments to optimize long-term outcomes.